your child likes to lay with their hips and knees bent and their knees very far apart, one of the things that you want to do is work on a little bit of improved positioning for their legs. So first thing you're going to want to do is bring the knees together. Once the knees are together, there are a lot of activities and exercises that you can do to help stretch the legs. So we're going to do a few passive range of motion exercises. One, you could bring both knees up to the chest. So I am just having my hands on the knees or below the knees at the shin bones and just kind of pushing up. That gives a good stretch to the hips and to the back. I'm not pushing down on the knees at all. Again, all these activities you can repeat 10 times, and you can do 2 or 3 sets of 10. So that's both knees to the chest. You can also do single knee to chest. So I'm going to support underneath the thigh and at the foot, and I'm going to bring the knee up toward the chest and back down gently. Now, if this leg can stay up on its own, or if you can kind of support it against you, that's great. If not, you can straighten it and use your leg to help prevent it from coming out to the side. Just watch your back as you are doing these activities. So this is single knee to chest. Again, you can do about 10 on the left and then go to 10 on the right. And then repeat 2 to 3 sets for each leg. Again, when both the knees are up, you can also do a lower trunk rotation, which sometimes we call it the windshield wipers. So you're just going to gently roll from side to side. It's a great stretch for the back. It's a great precursor for rolling. You can see if your child can help you actually do the whole rolling motion as well. And if not, you can help if you want to work on rolling a little bit by helping the shoulders and the hips. Another activity which is great is bridging, and that's something that can be really helpful, especially with if you have to change pants or diapers. You can ask your kids to help. You want to have them try and lift and lower. You can either use your hands at the bottom and try and lift and lower. Some kids do well if you have your hands on their thighs and you kind of pull back. And you can ask your child, try and lift that bottom up. Try and lift it up. So either one of these positions, and you don't have to lift it up super high. It's not like you have to drive a truck underneath it. Just want to lift it up a little bit. That's a great strengthening exercise for the bottom. And again, it really helps carry over if you have to do any diaper changes or clothing changes.